lesson on pacemakers where we're going to explore what a pacemaker is, why a patient might need one, and what they do in the body. So pacemakers are used to fix electrical issues in the heart. They might be on or implanted in the chest. They may be temporary or permanent, and they require X-ray confirmation after placement. So this is a picture of a heart and the electrical nodes within that control the heart rate and the rhythm. Here's the SA, the AV. It goes through the bundle of His and the Purkinje fibers. Now let's explore the use of pacemakers in more detail. Okay, so first let's review the electrical signals of the heart. So the electrical signals of the heart make the heart beat by setting the pace for the rate and the rhythm. So they make sure that the ventricles contract to pump the blood through the body. Without signals, the body wouldn't be perfused with blood. So this picture over here, it just shows where the nodes are and like the pathway to each other. So the SA nodes right here, this is the pacemaker of the heart. This is the natural pacemaker. So first it sends its signal through the atria and then to the AV node. So this is going to make the atria contract. So then it comes to the AV node, and then the AV node is going to send a signal through the bundle of His and through the Purkinje fibers. So this is going to make the ventricles contract. So a patient may have damage to the SA node of the heart, which is known as sick sinus syndrome. If the natural pacemaker of the heart's damaged, the signals are all out of whack, causing alternating slow and fast heart rates. A pacemaker might be implanted if there's poor electrical signals of the heart, irregular rhythm, slow rate, or ineffective pumping like heart failure. So there's different types of pacemakers that the doctor may choose to implant in the patient's chest, depending on what the issue is with their heart. So the single chamber pacemaker has one wire, and this is typically used for patients like with bradycardia, where the chambers are pumping correctly. However, the SA node is just not providing that electrical impulse necessary to keep that rate correct. The dual chamber actually has two wires. One is placed in the atrium and one in the ventricle to treat slow heart rates, heart block, or AFib. So in this case, the AV node is faulty as well, and it needs some help providing signals to the ventricles. So biventricular pacemakers have three different wires. They're used for situations like heart failure where the ventricles aren't working together. So pacemakers, some of them are rate responsive, and what that means is that they are able to respond based on the signals present in the heart, and then they will give signals as needed. So when you're taking care of a patient with a pacemaker, it's important to make sure it's functioning right. So if your patient's experiencing dizziness, syncope, confusion, shortness of breath, intolerance of exercise, pain or swelling at the site, you need to notify the doctor right away. Interrogation of the pacemaker may be done by a professional using a device to check the settings to make sure it's working correctly. The patient with a pacemaker is probably going to be monitored by EKG or telemetry per doctor's order. You'll notice pacer spikes on the rhythm strip, just like this. The location of the spike depends on where the pacemaker leads are located in the heart. So a spike before the QRS, such as up here, this top one, this is called ventricular pacing. If the spike is before the P wave, that is called atrial pacing. If there's two spikes, it might be dual chamber pacing. They may have one spike or two, depends. Pacemaker syndrome may occur after placement where the atria and ventricles are contracting at the same time, and this is very ineffective at pumping blood through the body, and this needs to be addressed right away. So if your patient has a pacemaker and their heart stops beating, you're going to use a defibrillator to shock the heart and attempt to restart it. It's important to avoid defibrillator patch placement over the pacemaker because that's going to damage that pacemaker and it probably won't work anymore after that. So when a patient's at the end of life, we have to consider deactivation. So if you're caring for a patient and they are going on hospice and they decide that they want that pacemaker deactivated to avoid prolonged life, then that's okay. That might be something you have to do. If you're caring for a patient that's a DNR, which means do not resuscitate, their pacemaker has to be deactivated after they pass away so that the electrical signals don't continue to try to pump that heart. So the way you do this is you get this big magnet that your hospital should have, and you're going to place it right over the chest, and it's going to stop that pacemaker. So patient education is crucial after placement of a pacemaker to ensure that it's not damaged at all. So the patient needs to avoid devices that interfere with it, such as MRIs. They need to keep it dry 2 weeks after being placed, so no showers. They need to notify all their providers that they have it so that none of their doctors accidentally order a test that could interfere with that pacemaker and damage it. They need to notify the doctor of any changes or symptoms like syncope, dizziness, shortness of breath. And if the pacemaker starts acting funky, they need to get it interrogated as needed. And this is going to be done by a representative of the pacemaker company that makes them, not the doctor or the nurse. So batteries must be replaced every 5 to 10 years, depending on the device. So the priority nursing concepts for a patient with a pacemaker include EKG rhythms, patient education, and perfusion. Okay, so let's review the key points to know about pacemakers. So pacemakers are placed when a patient has sick sinus syndrome, irregular rhythm, slow rate, or heart failure, depending on the doctor's decision. So the purpose of a pacemaker is to correct the electrical impulses and make the heart beat to perfuse the body correctly. So nursing care of the pacemaker, we should be monitoring the telemetry and EKG. We need to assess for signs and symptoms of malfunction like the syncope, dizziness, irregular rhythm on the telemetry. Patient death. So we need to consider deactivation if the patient requests it, or if they're DNR and they pass away, we're going to need to put that magnet over their chest to stop the electrical impulses. Patient education. So we need to tell them, you need to change the batteries every, however many years. You need to get it interrogated if something acts funky with it, and you need to avoid electronics and scans such as MRIs so that it's not damaged. I hope you got a good grasp on what pacemakers are used for and what to consider with your patients that have them. Please check out the lessons that are titled Cardiac Anatomy and Electrical A&P of the Heart to help you better grasp how the heart works. Thanks for listening. Now go out and be your best self today, and as always, happy nursing.